Hello everyone, welcome back to Yazhini Spark. Let's hear and learn together. I'm Yalini, your nursing tutor from SNS College of Nursing in Coimbatore. Today we are diving into the essential topic for BS nursing students, which is our nutrition assessment and educations from the unit of 10 and part 1, which we are the nursing students, the healthcare professionals, or just someone passionate about health. This video is for you. And this is a main important aspects for all the numbers, and we will explore how to assess the nutritional status and why it's main important for the patient care. And don't forget to like, subscribe, and share to your friends. Let's get started. In this slide, we will be discussing about the foundation of nutritional assessment, which is of truly gap how to we can truly grasp how diet influences the health, and we need a reliable tool to measure what the people are eating in the population. And assessing the dietary intake is not at all easiest task, and is one of the toughest job for the all the healthcare professionals, and often it's called a weakest link in the nutritional episode of it. And because people each different habits, each people have a variations in the habits of eating. So as a nurses we have to understand all this, so this will be helping us to support the patient better by identifying the diet health connections earlier. And just think about the poor nutrition which can lead to everything from fatigue to chronic diseases. And also we can share we can have that more small diseases to chronic diseases, acute to chronic, this may be affected. In this comment we can share about your thoughts. Have you even struggled with tracing about your own diet? Let's share in the comments. We can now moving on to objectives. Why we need to bother about nutrition assessment? There are several multiple vital purposes. First, evaluating the risk. This helps spot nutrition-related issues that could affect someone's health now or later, like deficiency leading to anemia. And second is a routine patient care, especially for the hospitalized folks. And we use it to monitor the treatment effectiveness and ensuring the IB nutritions or diet are working. The third is of how we have to identify who needs interventions, like supplements or malnourished patients, or tracing how well the programs works. We have to assess it all. For populations, it reveals overall nutritional health and common risks, such as vitamin D deficiencies in urban areas, and it gives insight into the dietary patterns and what food people prefer and why. This is a golden for planning health educations, like workshops on balanced meals. We can estimate intake of energy, nutrition, or even the components like antioxidants. Plus, it may shed lights on food habits and attitudes. So, cultural preferences or aviations that influences the eating. Finally, we are comprehending about the evaluation of food consumption. This may be of individual level or it may be of national levels too. And we can remember that factors like food adequacy, that is qualitative and quantitative, are based on the diseases also, like heart disease or hypertension or diabetes. And physiological status like pregnancy, which all are the main reasons which may be of pregnancy or maternal malnutrition, which can all causes of low birth weight and disabilities and poor quality of life, or even the newborn mortality. As the nurses, we have to know about these conditions, and also we have to advocate for the better nutrition for the particular patients. So we have to have a knowledge on this so that we can give the better patient care for the patient's life. Let us break down the methods of assessing nutrition status. Generally, we use direct method, which is of characterized as ABC. Today, we can focus also on A, which is of anthropometry. We all know that already, and also there are indirect methods like dietary assessment and food diaries and vital health state statistics, that is of morbidity rates, which is of linked into nutrition. Now we can see about the anthropometry, which comes as a andro means a human and metry means measurements. It's all about measuring body components like bones, muscles, water, and fat. which is of goes to nutritional health. One measurements alone cannot be sufficient to make the assessment. We need combinations of all so that we can give the good effect to the patient care. And it's a practical in clinical settings. It is not invasive or quick. We should know the all the measurements so that we can get an appropriate answers. So we can deep into the orthometric measurements in next slides. Starting with the weight is the main aspects. Under two, we will be weighting with the scale and accurate to 0.1 kg. For the adults and hormonal kinds, we will be better. We will be works also to the 0.1 kg. While measuring weight, it tracks the children's growth and energy, protein needs, and how to determine the body composition, sudden changes, and signal illness like infection causing weight losses. In all the aspects, weight is a main category so that we can assess immediately. Like in cancers and thyroidal issues, we always note the main aspects of the weight. So it plays main role in assessing the patient. Positioning the head. Imagine a line from your ear hole to the lower eyelid parallel to the floor. Shoulders, buttocks, and heels touches the vertical stand. We are using for portable anthropometry and recording to the nearer millimeter. Compare this with the standard growth so that we can measure whether standing growth or overgrowth for the patients. And what does you mean by MUAC? As of nothing but upper mid-arm circumference. We already know that midpoint of shoulder tip, that is of acromion, to the elbow tip, we are measuring is of a MUAC. And which when the MUAC is low, then there's muscle wasting. Often it is of, we already know, we had seen in previous section, which is of when muscle wasting is there, it's of chronic malnutrition. Is the main important aspects. We all know that skin folding thickness, which is of mostly estimating the subcutaneous fat, which is using the caliper. In this, we can know the whether the fat is more under the skins. By reading this, we can suggest the obesity risk for the patients. And opposite to that, for the malnutritions, we can measure their undernutrition. The risk can be this opposite to that. They will not have the much muscles. So we can easily suggest. And head circumference is almost all know that it is of around forearm to the back and the back of the head. And this is body mass index is we normally use it in day-to-day life itself. That is of weight by divided by height to meter square. This is of height, we will be measuring centimeter, that has to convert it to the meter, and so that we can get it easily. So, according to that, we will be classifying underweight or malnutrition, and according to the BMI, we will be suggesting. We covered the basics like objectives and orthopometry measurements, and remember good nutrition assessments which leads to better patient outcome. So thanks for watching this video, and yes, Spark, let's heal and learn together. If this video is helpful, drop your like and share to your friends and comment your questions. I will always here to reply it, and subscribe for my channel. And this is Yazhini Spark. Let's heal and learn together. Stay healthy and see you on next times. Bye.